presentation so far. Just a quick point on whether there's been an audit in the Tim Ryder. I mean, my memory of that was that one of his main conclusions was there'd been no stress testing, no real risk assessment. So, you know, it's all very well having these wonderful, blueprints and proposals for how it's all going to work much better with these specialist hospitals, but they hadn't done any real risk testing on, you know, ambulance times and the changeover from sort of, you know, in-hospital care to out in the community care. But that's not the point I want to. I just want to tell a very quick story about something that happened to me a few weeks ago. I have an elderly mother, 82. Like many people in their 80s, she's got multiple health problems now. I don't want to paint her as a cripple or anything. She's very active. She goes to the theatre regularly. But now and again, she has turns and bouts that she's not sure what causes them. And recently, she suspected that she'd had a series of mini strokes. So on a Sunday night, I faced the decision what to do. What she really needed at that point was reassurance and some sort of differential diagnosis. You just can't call up your GP at that point to get it. So she lives quite close to St Mary's Hospital, but knowing that Charing Cross had a better stroke unit, and also doing the calculation, which I think many families do, because you know that if an elderly parent is admitted to hospital, you want them to be somewhere that you can actually go to easily and provide the aftercare, because you need an advocate. When anyone goes into the NHS now, family has to sort of be there to sort of help and to explain what medications they're on. There's so many other questions that come out. So that's one reason why I think it's really, really important that we have we keep all these hospitals open, so that everyone has a choice, a wider choice as possible. And you know, if you're talking about closing a good stroke unit, that just seems to be crazy. The other point I want to make is when we got to the hospital, it was very, very striking who was actually staffing this unit on a Sunday night, right, in the middle of February. The woman who took our details at the front desk was Afro-Caribbean. The first front of line was a GP who takes the initial diagnosis, was from the Ukraine. When we got into the hospital, she was seen by an excellent nurse from Portugal. Another nurse came up to help. I said, "Where are you from?" She said, "I'm from Bangladesh." And then finally we got to see a wonderful young junior doctor. He also wasn't an indigenous English person. He was from Hong Kong. And I think this is familiar to anyone who goes into any. You will see that they are staffed by people from all over Europe and indeed farther away. My question to the UK candidate is, who the hell do you think is going to do these jobs if you stop immigrants coming into this country?
Well done!
Thank you. Thank you for that, which was really useful. I just want to hold that there and get a few more questions in. There were people over here. Sorry, do you want to take this? You've got to run, Luna.
That's okay.
The lady with the who's standing up and taking the leg of it.
Hello, thank you very much. I'm Ruth Cadbury. I'm Labour's parliamentary candidate for Brentford and Isles constituency, which is the eastern half of the Borough of Hounslow. I'd first of all like to thank Save Our Hospitals campaign for the amazing work you've been doing, keeping the issue alive, keeping pushing, keeping the stall going, meetings like this and so on. And I'd also like to thank Crispin, Flintoff and the rest of the Labour team in Chiswick for the work they've been doing on keeping the issue at the forefront on the doorsteps in Chiswick in all the campaigning they've been doing, because it is the single issue that is coming back as being important in terms of the future of public services in Chiswick. And it's obvious why it's an issue in Chiswick, because people are genuinely really worried about the loss of an incredibly valuable service that they can get to quickly and easily. I want to just widen out the context to the wider area. I'd particularly like to thank Louise for describing what's happening in the hospitals and what it means for the hospital medical staff and GPs. The other side of this context is the massive cutbacks in social care in local authorities, because this is all part of you can't isolate off the NHS or acute hospitals without looking at what's happening in health and social care. The fact that we have a rising population of people who are frail and elderly or who have long-term conditions, and that's not going to go away. We also have an increasing population in London. That's not going to go away. We need to retain the services we have. We also need to develop and modernise and change the ones, particularly in social care. Because until we do that, we're not going to reduce the waiting lists at A&E, we're not going to be able to reduce the waiting lists in GP surgeries. And we shouldn't have people having to go back and back again to their GP, or having to go to A&E because their GP is too busy to see them for the next 3 weeks. We should be getting proper support that's much more social care and much more community-based at the point where people need the care they need. A lot of the care they need is predictable. If you've got diabetes, if you've got a heart condition, if you're frail and elderly, maybe dementia, a lot of the care you're going to need could be predicted and could be put in place, but there just aren't the resources for that. And that's why Labour is proposing a holistic joining up of health, social care, and of course mental care, which is also a complete Cinderella service. I was going to ask the question of UKIP, but that's already been asked. So can I just mention West Middlesex, because West Middlesex serves about 2/3 of the borough already. Its A&E is already full, and its own future is uncertain because we still haven't seen what's happening with its relationship. Now it's not going to go. No, it's not going to go in with Imperial. Is it going to go with Shell West or not? We don't know. Thank you.
Thanks. Give it to Peter. Oh, actually, can you just hang on a sec? Sorry, Peter. I think people are saying they'd quite like to respond now, so let me quickly do that. So the question was really about a global workforce and then about social services. So I think I'll start on this side this time. Crispin, do you want to add anything? You don't have to.
Well, yeah, I mean, London is cosmopolitan, and I can't get my head around the idea of putting a cap on immigration for the sake of it. It just makes no sense to me. That's how we live. London and Britain is cosmopolitan, and it will always be. And as far as this debate, this discussion is going, I'm just still getting over the fact that the Tories haven't even bothered to turn up. It appalls me that they can't even bother to come here. I'm really not interested in scoring party political points, but I think that we do need to make people aware that this hospital is in danger, and they could come back and say, no, don't worry, we'll save it and we'll do this. We need to hear what their argument is. They can't just duck the issue. And the thing is, I just want to make this clear. In Chiswick, they think they have the vote won, that they are going to win all the Chiswick wards, all the councillors will be Tory, and they don't even need to come out and discuss it. We can give them a bloody nose. If we work on it, we've got a few days, we can work on it and give them a bloody nose, and this is what I hope will come out of this meeting. We may not be many of us, but if we all go out and try as hard as we can to give them a bloody nose, that's what I want to say. And thank you very much for giving me a couple of minutes to say that.
Bloody nose.
The problem with giving the megaphone away is you can't make the candidates stick exactly to the subject, so I rely on them from now on. So Louise, the questions are about a global workforce and social services budget cuts.
Yes, and the NHS has always depended very much on people from around the world working in our hospitals and our GP practices. And the question was asked, who will staff our hospitals if UKIP had their way? I think one issue is actually that there are huge cuts to nursing training and midwife training and district nurse training. Only 5 district nurses qualified in London last year. So we do need to develop the workforce to actually meet the needs of a growing NHS, and that the demands are growing because people are living longer, but they're living longer with more complex conditions. The population is growing, and technology means that we can do a lot more than we could do before, but that costs money. Some of our cancer drugs cost a lot. And people are expecting that. They're expecting a modern health service, and it's estimated that a modern health service has to increase its funding by 4% a year. That's across the whole of the Western Europe. And because our NHS is being flat funded, it actually means there's been a cut. There have been cuts. And that's what we're seeing, cuts. Now, UKIP, I've been out campaigning. I have to reply to the UKIP thing. I've talked to some quite lovely, ordinary, normal people who say they're going to vote UKIP. And when I explain to them that UKIP is against holiday pay, sick pay, maternity pay, 31% tax rate for everybody, wants to privatise NHS and cut funding, they are appalled. So UKIP get away with it by actually lying to people about what they're really saying. This idea that the NHS is inefficient, that Paul Nuttall said, he said it at the BBC Question Time in Lewisham when I was there, he said it in front of us. It is one of the most cost-effective health services in the world, and that's the Commonwealth Fund and the OECD that have said that. Privatisation is inefficient. It fragments care, it undermines the cooperation and collaboration that leads to seamless and smooth care. So it's a waste of money and it's destructive. We must deal with these arguments, and UKIP are trotting them out without even the slightest thought. Then he says, all I care about is my local hospital. Well, actually, you cannot understand the threats to your local hospital if you don't understand the big picture. Why would I be here? We've won in Lewisham. I could just sit and put my feet up now, couldn't I? No, the whole NHS is under threat. And we have to understand the whole plan, which is to shrink down the hospital, sell off the estate, liquidate the NHS estate, and actually end up with a two-tier system. They're starting to float the idea now already of payments. Payments for going to your GP, payments for going to A&E. Next thing, we'll be having an insurance-based system brought in. That's the future. That's what we're aiming for, we're heading for if we don't stop it. And finally, the value of local hospitals. It's absolutely crucial for the vast majority of conditions that people need to be admitted to hospital for. 95% of those conditions, a local DGH is perfectly good. And in addition to being competent and able to look after patients, it helps us to recover if our friends and family can visit us. It also helps with better discharge arrangements and follow-up because there's better coordination when the local hospital is rooted in its community with all the social care and GP links around. Social care is intimately related to health care. The social care budget has been slashed, 20% cuts. About $250 million elderly people are now no longer eligible for care to help them to stay independent in their own homes. And millions have been removed from that budget. So these are crocodile tears that the government and the coalition and the UKIP and all that shed for elderly and disabled people, because the policy is to cut that to the bone. And we must demand decent, proper spending in healthcare and in social care. I'm a bit worried about the Labour policy of bringing health and social care together. It sounds good in some ways, but remember, social care is means tested. You pay for it if you're just above the threshold. Healthcare is free. Very worried about merging the two and blurring it and ending up that being a way that healthcare ends up being charged for too. So I think we have to look out for that when we hear this policy of bringing the two together.